lots of people have meniscus tears and don't even know about it. That is, lots and lots of people don't have any knee symptoms, and yet if you look on an MRI of their knee, you will see a meniscus tear. Now, how many people are walking around with asymptomatic meniscus tears? To be honest, the exact number is hard to pin down because different studies differ a bit. The older you are, certainly the more likely you are to have an asymptomatic meniscus tear, that's for sure. By the time you're 60, most people who have zero knee pain will still have a meniscus tear in their MRI if you were to get an MRI for whatever reason. Let me throw some interesting studies and facts at you so that we can fill out the picture. One study looked at 57 patients with symptomatic knee meniscus tears. The patients in this study were between the ages of 18 and 73, with an average age of 43. The study took an MRI of the asymptomatic knee. So just to recap so far, the folks in the study were people with symptomatic knee meniscus tears in one knee, and now the study is looking at MRIs of the opposite knee, which have no symptoms. In that asymptomatic knee, 63%, or 36 out of 57, had meniscus tears. That's a lot of tears with no symptoms. And remember, these are people who are only on average 43 years old. Other studies have found that as many as 76% of people over the age of 60 with no symptoms have knee meniscus tears. That's an incredible amount of asymptomatic meniscus tears. The general findings, to summarize, is that knee meniscus tears can cause symptoms, but they don't always. As you get older, whether you have knee symptoms or not, meniscus tears become very common, and they get more common as you age. It's not so important to peg down a particular number of asymptomatic meniscus tears. The point that you have to know is that if you see a meniscus tear on an MRI, it doesn't necessarily say anything about whether or not that meniscus tear is going to be symptomatic or not. This is true for tears of all sizes. This shouldn't be surprising information for any healthcare provider who comes in contact with patients with knee issues, and it's certainly not controversial for anyone who has read the literature. And yet, you'd be surprised at how many times a patient with knee pain will get an MRI and there'll be a meniscus tear, and then all the focus becomes squarely focused on just that meniscus tear, and in certain cases, immediately surgery becomes discussed as the most likely and the best treatment option. This is madness. Madness.